No, not all colon polyps lead to colon cancer. Hi, I'm Dr. Raghu D K. I'm a consultant gastroenterologist and hepatologist at Apollo Hospitals, Jubilee Hills, Hyderabad. So today we're going to talk a little bit about colon polyps and colon cancer. Colon cancer is probably one of the most important cancers, especially of the Western world, although it's creeping up more in our part of the world. It's the third leading cause of cancer in the Western world and second most common cause for cancer death in the United States. On an average, about 100,000 people develop colon cancer every year, and about 45,000 of them develop rectal cancer, which is the distalmost part of the large intestine. So what is colon cancer? Which is abnormal growth and proliferation of the lining of the large intestine leading to cancer. So what predisposes these people who develop this colon cancer? They develop a condition called a colon polyp. A polyp is nothing but an abnormal growth that develops from the inner lining of the large intestine. There are several types of colon polyps. There are hyperplastic polyps, hematomatous polyps, adenomatous polyps, serrated polyps. Not all polyps develop into colon cancer. There is an adenoma-carcinoma sequence that happens. So it's the adenomatous polyps or the serrated polyps that are predisposed to develop into a colon cancer. So once the colon cancer develops, depending on the stage of the colon cancer, the treatment would vary. So my advice to everyone is, everyone who has certain features such as change in your bowel habits, frequent episodes of blood in your stool or black stool, persistent belly pain, change in your stool caliber, unexplained anemia, unexplained weight loss, or loss of appetite. All these are symptoms that need to be investigated further by going to your closest gastroenterologist to see what investigations are required to investigate further your condition. So your gastroenterologist, whoever would look at you, would do certain blood tests to look at your blood counts. They would do some stool tests, fecal DNA tests, FIT tests, several tests available, certain endoscopic procedures such as a flexible sigmoidoscopy or a colonoscopy to see if you have any colon polyps. Once we see these colon polyps, we use special techniques or procedures such as a snare or a biopsy forceps to remove these polyps. A pathologist examines or investigates further these samples that we send, and then depending on the type of polyps we have, the frequency of your examination or the repeat procedure would depend. So once you are diagnosed with an adenoma, depending on your risk factors, such as you have a family history of colon cancer, or if you have a hyperplastic polyp, which usually is never a precancerous polyp, your frequency of your next examination would depend. So in a nutshell, what I would say is not every colon polyp is cancerous. There are certain kind of colon polyps which are benign and do not progress into colon cancer. So you need to find out with a trained gastroenterologist to find out what kind of polyp you have, which will determine your risk of developing a colon cancer, and your future colonoscopy screening intervals also will be determined based on that.